Good evening, everyone, and welcome to Online Pet Health Academy's second webinar. Our official launch is in January. Our platform is aimed at pet owners wanting to learn more, and we have some amazing webinars lined up for just that purpose. Tonight, I'm honored to be introducing our lecturer for the evening, Dr. Hannah Capon. Hannah is an experienced small animal vet based in the UK. After 14 years in practice, Hannah felt the greater attention needed to be given to managing the canine arthritis, as essential information was not reaching pet owners of these dogs. In 2016, she launched an online service, Canine Arthritis Management, to help educate owners how to identify the early signs of the disease, diagnose the condition correctly, and to implement effective long-term management plans. Please note there will be time at the end of the webinar to have questions and answers. If you are new to the webinar format, you can look to the right-hand side of your screen. There are two boxes, either one for questions or chat. You can type your questions here and I'll read them off to Hannah at the end of the webinar. And now it's over to you, Hannah.
Hey, welcome from the UK. My name's Hannah Capon. I'm a small animal vet based in the UK. And I'm going to talk to you tonight about how to manage arthritis from an owner's perspective. We're going to be going off grid a little bit. There's a hell of a lot of content in this topic area. So unfortunately, we're going to gloss over quite a few things, but hopefully we'll open up avenues for us to discuss further at a later date. So let's get on. So as I say, I am a registered vet in the UK. And I also practice something called garden myotherapy. Canine arthritis management came about by combining my veterinary skills with the complementary therapy called garden myotherapy and becoming mobile and going into owners' homes. I had been a vet practicing in the normal clinic setting for many years, and I'd gained an interest in arthritis about 4 or 5 years ago. And I can remember the day clearly when it really came to a head, because in one afternoon I had to put 2 dogs to sleep in quick succession, and they'd both been on the diary as having gone off their back legs. And as far as I know, that is not a diagnosis. That is not a disease in itself. That is a sign that something hasn't been attended to, and we've failed. So canine arthritis management was kind of born from the fact that I wanted to improve owner education. So canine arthritis management now is proudly displaying all of these areas that we get out there and try and educate owners. There's a website, it's 100 pages, designed to help owners from identification all the way through to the end of life care. We have a very interactive Facebook community. There's about 4,500 people on that, and it's really busy, so please get on board. We're on Instagram and Twitter, and we've also recently launched an owners forum. So we're really trying to grow that so that people can teach us, we can share advice, tips, and we can build a community where owners can support each other. So tonight we're going to be talking about the successful management of an arthritic dog and how it doesn't rely solely on visits to your vet or your therapist. My real strong conviction is that we need to be empowering owners to take control, take charge, and to play a greater role in managing this disease. I myself am an owner, and I think that certainly has contributed to my understanding that this isn't a disease that is a trip to the vets every 3 months. It's a day-to-day living. This is my feelings on it, which is quite powerful. This is definitely from an owner-vet perspective. Me personally, I found it extremely hard emotionally to watch my dog age. I found it very hard physically to change my routines, our life, what we used to enjoy doing together. And I feel that this disease isn't just a disease of a dog's joint. It's a consuming, emotionally and physically debilitating disease for the owner and the dog. So tonight we're going to go at it from a slightly different perspective. We're going to fleetingly visit these different topic areas before getting our teeth into something that I'm really passionate about. The way that my mind works, this is how I tend to approach each case that I see. I have around about 10 boxes that I go through in a very methodical way. So we had a lovely webinar only about a week, 2 weeks ago about identifying signs of chronic pain, a webinar called The Grumpy Dog. Just to recap, chronic pain presents very differently to acute pain. Acute pain is adaptive pain, it's a reflective type behavior, it's to prevent harm. Chronic pain is very different, and it's something that you have to learn to live with. So therefore, it presents itself in these 4 categories: behavioral change, postural change, muscular and physical appearance changes, capability and gait changes. If you're seeing 3 of these categories met in your dog, then you do need to have that looked into for signs of chronic pain. Acute pain is very different to chronic pain, as just said. It's a very different presentation. It's a very complicated physiology, and the treatment plans are therefore very complex. Now, this yellow sentence here is quite important to me. All inputs count. And this is something, again, getting back to owner empowerment. What you do, those little things make a massive difference. Chronic pain needs to be attacked from all angles. Do not think putting that rug down or keeping your dog warm is not important. It really is, and it is a massive game changer. This is something that tends to send the message home quite well. I use this slide a lot when I'm lecturing vets. Chronic pain is presented so differently, but it's ubiquitous in our world. 1 in 5 people worldwide suffer severe to chronic pain. But I don't see 1 in 5 of my friends or family or colleagues screaming in pain or limping. Humans also present chronic pain in a very subtle way. So when you think of it like that, it's really quite obvious that dogs would also present pain in a coping strategy type way. So that's just a take-home message, that if you ever need to speak to a colleague or a friend to explain, ask them about whether they have bad back, whether they have an aching shoulder. Do they scream? Do they tell the world continuously? No, they learn to live with it. So chronic pain in humans is communicated verbally, whereas in animals, it's a visual presentation. As I say, think back to those 4 categories: behavioral change, gait and capability change, muscular changes, and postural change. This is quite important because looking at these identifiers in a different way, you can use them as observations to monitor. Some people use something called client-specific outcome measures, and it's a way to actually work out whether what you're doing with regards to a therapy, a drug, or a supplement, or a change in lifestyle is actually making a difference. It's semi-objective. It has been shown in a number of cat studies to be accurate in looking for changes in pain state. It can take a little bit of time to get your head around it at first, but once you've got the knack of it, it's extremely easy to use on a day-to-day basis. It tends to be with the owner identifying changes in behavior, either behaviors that have developed or they've stopped, changes in posture, and writing them down and looking for change. You choose between 3 and 5 behaviors, and then you monitor them. Now, I really encourage all of my clients to use these, be it with my own therapy, the Garland myotherapy, with hydrotherapy, with physiotherapy, with starting a non-steroidal, whatever you are implementing, we want to know if it's working. So having just a subjective assessment of I think so, it doesn't actually help anybody. So I'm just going to show you a few examples. This was from a cat study. So these tend to be catch traits. And by putting them into a chart like this, you can watch and see if there's improvement or deterioration. There is a chart very similar. It's available online on our website for you to print off and use, and instructions how to use it. But you do have a look at overall demeanour, overall mobility, and then you choose behaviours that your dog have either started or stopped, and you can monitor them, and you can even score them out of 10. So I'm just going to give you an example of how I use that with my own dog. This is Holly. So this is her obviously in a bad day. This is her on a good day. The things that I'm always watching for is the position of her ears. She's very expressionate with her face. And if those ears are back, I know things ain't great. She has a very low vertical tail carriage. She has a condition called lumbosacral disease, and that can mean moving her tail can be painful. So if that tail's vertical and it really hasn't got much life in it, I know it's a bad day. She arches her lower back when she is having a bad day. It tends to flatten off when we're having a good day. So having a look at these 6 things that I'm always watching for, I can work out when I'm having good days, bad days. And then you can quantify whether they're improvements, so you're having more good days, whether that's linked to a therapy change or a new drug you've implemented. So the next thing on our 10 boxes was getting a correct diagnosis. I'm going to fly through these quickly, but these are really important. Doing a one-on-one service and going to people's homes, I've stumbled off quite a few incorrect diagnoses. I've had kidney disease, splenic tumour, libramide toxicity, hypothyroidism, unstable cruise ship disease. What I'm trying to say is that there's a real tendency for us to diagnose arthritis just by looking at the dog from afar. That's not good enough. We really should be doing a full clinical exam, which involves a neurological exam and an orthopedic exam, and ideally imaging to diagnose it. And this is a really good example. You would never, ever start a dog on insulin if you hadn't confirmed it was diabetic. But we are starting animals on pain relief and therapeutic protocols when we haven't actually clarified that it is arthritis. Again, when I speak to vets, I do make it really clear. There are very few other chronic diseases that we would just speculate. You would never diagnose a dog as having cancer just by looking at it from afar. You would never diagnose hypothyroidism by just looking from afar. So what we need to do is make sure that we actually work with our vets and get the correct diagnosis. Realistic expectations is really important. It isn't curative. It's a long-term disease, and a lot of owners aren't educated regarding this at the beginning, and their expectations are therefore very high. What we try to do at Canine Arthritis Management is make it clear to people that this is a long-term condition. There is likelihood of associated conditions in this age category, and it is a progressive disease. There's also many variations, so there's no set treatment plan. And unfortunately, you have to certainly try some things to see if it works before saying, no, it doesn't. So do make sure that you understand what your dog's condition is. Working with your vet is really important. There's a tendency for a lot of owners to kind of go renegade and start sourcing all of their own therapies, supplements. There's a real benefit working with your vet. In the UK, the vet is the only person allowed to diagnose and prescribe, so that's one key point. But also finding comorbidity, as I suggested earlier. Something that really used to frustrate me as a vet, so I've just put it in yellow here, is there is no point as a client nodding your head on the other side of the table when you actually really haven't kept up. You're not sure what the vet's saying, but you feel embarrassed or you feel time is short, so you just nod that head and leave. This is your opportunity to ask the questions, so please don't shy away from it. Regular vet checks are essential. I've had numerous dogs where, as I say, comorbidity, progression, or an incorrect diagnosis was found on subsequent rechecks. So don't be shy of going for those 3 to 6 month checkups, please. Important point here, as a vet, I just want to state this really quite clearly. Vets are only concerned about how much money they earn. There is definitely a group of owners that believe that vets aren't they're not in it for the right reasons. So I actually did a little secret survey about 2 weeks ago on Facebook. There's a Facebook site called Vet Stay, Go or Diversify, and I had over 200 vets reply within about 48 hours. And just to let you know, 99% of them aren't on any commission. So what we diagnose and what we prescribe isn't influenced by what we take home. Next thing, pain control. Obviously, this is the most important thing, because if it wasn't for the pain of arthritis, it wouldn't really be a problem. You can live with the dysfunctional joint. It's the actual pain that comes with it. And this is my treatment pyramid. And I use this a lot to show owners how much they have control over and what volume of this pyramid they can influence. I use it to really empower my owners to take control of the dog's condition. And the simple things like the weight management, the care in the home environment, modifying those exercise regimes can have such a profound effect. But pain control sits right up there. And we're going to have a quick word about this. So anti-inflammatory medications, bit of a contentious issue. Some people fear them because of side effects. Some people fear them because of cost. Some people don't want to go to the vets and they're only generally accessible via them. I just want to make it really clear, it is unethical to leave an animal in pain if pain relief is available. Often vets will prescribe you an anti-inflammatory not with the intention of leaving you on it long term. They're doing it to get your dog's pain state controlled. I had a lovely owner send me in a brilliant video clip I'm going to show you in a moment. But I do feel it's important to state this. If you do not control the pain of arthritis, your dog will choose to exercise less. Their joints will become immobile. Movement will become more painful and almost unbearable. Now, this is a really harsh take-home message, and it's one of the reasons that canine arthritis management was born. Because it's one of my owners, when I told them this, they looked at me aghast and said, "What, arthritis kills?" And it does, because if we don't attend to it properly, it is a downhill slope and it can be quite rapid. So I'm just going to show you a video clip. Oh, just quickly. I did another survey on the Vet Stay or Go or Diversify, and I asked vets, would they prescribe anti-inflammatories for their own dogs? And of the 200 vets that replied, 100% would put their own dog on NSAIDs. And I just want to make that clear that we know, yes, there can be side effects. Do we put our own dogs on it because we know that the benefit outweighs the risks? Yes, and my dog is on an anti-inflammatory long term. This is what the video clip I've been harping on about. This was sent in to me by a lovely owner. This is Scout. He's got elbow arthritis. Just to let you see how powerful pain relief can be, this is 24 hours later. We're not saying that we want you to put these dogs on anti-inflammatories long term. They have a place in a treatment plan. So please do work with your vet regarding this. Weight control, again, massive topic. Haven't got time tonight, but hopefully you'll be able to see. This is one of my cases, Fudge. This is Fudge before weight loss. This is after weight loss. And this was only, what, 2 kilo weight loss? Profound difference. So do get your vet's help or vet nurse or a therapist's help to body condition score your dog. Body condition scoring, I tend to do it out of 9. I aim for 4.5, and I am trying desperately to push my owners to between 4.5 and 5.5, because carrying that extra weight is a massive negative factor for managing arthritis. It also, this adipose tissue, this fat, is a source of inflammatory mediators. Now, what does that mean? That means that arthritis being an inflammatory condition, this fat is like petrol. So when you're looking at your dog thinking, oh, yeah, I know he could trim her down a little bit. I'll do it next week. Nope. Start acting now. It's one of the most important things that you can do to influence your dog's pain state. Complementary therapies, again, this is a huge topic area and hopefully we'll get to revisit it at some point soon. I find that it can be quite daunting, it can be quite confusing. There's many different avenues to go down, there's many different qualifications, experience and skill levels. What I suggest is making sure that the therapist you work with helps you work with objective assessments. So going back to those CSOMs, client-specific outcome measures, it then enables you to work out whether that therapy is working for your dog. So for example, if I took Holly to an acupuncturist and I went once a week for 3 weeks and I didn't see any of her markers, those 6 markers I showed you, change, then I would say to myself, this isn't working for her. It doesn't say anything about the therapist. It doesn't say anything about the therapy, but it's not working for me, our condition, our situation. I now need to look elsewhere. So please download that chart, take it with you and start exploring complementary therapies. There's much to be said about it and there's lots on the website. Diets and supplements, oof, good. Again, a very big topic area and everybody has an opinion. Again, hopefully we'll get a chance to tackle this at a later date. Again, there's quite a lot of information about it on the website, and we are really going to get down and dirty with it on the Canine Arthritis Management Forum in the new year. But what can be believed is that, yes, supplements and diet changes play a massive role in a treatment plan. But again, the owner must be educated regarding objective assessment. I'll just give you a quick little story. I went to one little old lady's house about 6 months ago, and she had avoided going to the vet for fear of what the vet would say. There's many owners out there that are scared that the vet would tell them to put to sleep. But instead, she spent her money on supplements, and she had about 4 or 5 glossy, shiny pots. And all the contents overlapped. You know, you're looking at a huge expenditure per month that this pensioner was paying for. How much effect was it having? I don't know. I can't say. But a trip to the vet, prescription of a non-steroidal, and an introduction to a therapist in this situation I would have felt was better. Rebuild. This is something people don't talk about much. I feel it's imperative that when you're starting a management plan, you have to take into consideration the fact that you've got to rebuild after you've created your treatment plan. So once the pain of arthritis is controlled and the lifestyle has been adapted to reduce hazards and further injury, then the rebuild can begin. Now I mean this physically. So Dr. Megan Kelly has a lot of literature available for you guys to access about strengthening programs. So not only physically, but also mentally. You know, when Holly started to show her age, a lot of the things that we used to do had to go. We used to stand up paddleboard together, we used to surf together, swam a lot together, spent most of our life on the beach together, camped together, long walks. What did I replace them with? Now, a lot of owners get very disheartened when they're being told all the things that they can't do. What I would like to do and encourage other therapists to do is to think for that final little step of then opening doors for things that they can do and rebuild that relationship. Again, I'm really proud of the team behind CAMP because Facebook really strives to do that. We help people get the most of this new relationship that they have with their dog. So as you can see, multimodal management of arthritis is really extensive. It's extremely complicated disease, but all inputs count. Now this is kind of a sneaky little diagram here. The triangles are what vets and therapists can help support you with, and the green is what the owners are in charge of. And what I hope to show with this diagram was that equal importance, each have their role to play. So do not doubt the things that you do as an owner. They really do make a big difference. So this is the topic we're going to tackle tonight. I've got about 20 minutes, so I'm going to fire through. Something very close to my heart is preventing further injury. Now this is Bonnie, and Bonnie belongs to 2 of the most dedicated owners I know. They're absolutely adorable, these people. Bonnie's their first dog, and I think they rescued her, if I remember rightly. This was me on my first house visit. Now, Bonnie has lumbosacral disease, which means that the nerves that come out just in front of her pelvis from her spine are being pinched. And that is an extremely uncomfortable condition. Now, this is Bonnie's world. This is where she spends most of her life. Her resources are up here in the kitchen. It's where her bed, her water, her food. And she has to deal with this multiple times a day. But when you slow it down, you can see how much effort it is taking to get up these steps. You might even question whether this circling is coping strategies, preparation strategies. Look at the strain through that dog's body. So, having started my one-to-one service and going to people's homes, I realised that this was something that really wasn't being tackled properly. And as a vet, I'm really good at prescribing drugs, and I can send you to good therapists and I can help you get the weight off. But I wasn't really tackling people's lifestyles which needed to change. And it's amazing the things that people don't notice because they've been doing it all of their life. So we're going to run through a quick through the keyhole approach to lifestyle. Here we go. Home management of the arthritic dog. So the reason this is really important, I'm just going to run through a couple of cases because it will really give you a good take-home message. So Monty, German Shorthair Pointer, I saw him many years ago, and he was on the way to having an elbow replacement. The owner was extremely dedicated. She had explored many different avenues such as physio and acupuncture. She'd been using an objective measurement, but they weren't getting anywhere. I went and did a house visit. She'd always taken the dog to the therapist hadn't come to her. And as I knocked on the front door, I heard this almighty noise as this 35-kilo dog came flying down the stairwell, 90-degree bend, second part of the stairs, onto a tiled floor, and there was a wall right in front of it, so it had to sharply turn left or right. And this dog did this countless times per day. The dog was never, ever going to have a chance to recover. This is Bertie. Bertie's a friend's dog. I actually met him as a client, but now he's a good friend of mine. Bertie lives in a 3-story house, and he presented with a right fore elbow lameness. And yes, he's arthritic. We've chosen to manage it conservatively. But he was having a horrendous time. When I went and did the house visit, I realised that the owner was always using the front door, which was on the lowest floor. And this dog had to get up some really steep steps into the living area. And if he wanted to go out for a wee, he had to go back down those steps to the front door. What was quite funny was there was French windows into the back garden from the living area. And by simply changing that element of their life, the degree of lameness reduced dramatically. So let's go through some of the common problems, massive danger areas. I did want to include a slide that I put on Facebook only a few weeks ago. I was working in London and a severely arthritic dog came in late at night. I was doing emergency work, and he'd had acute decompensation. He was not in a good way, and we were using methadone and ketamine, constant rate infusion to try and control the discomfort. But he unfortunately didn't stand, and we opted to put him to sleep. He'd fallen down the stairs. He'd been doing okay, but he was very arthritic. He was very wobbly, and he was very weak. And being allowed to do these deadly tasks, he'd failed and he'd fallen, and it was irreversible. So please don't underestimate how dangerous stairs can be. Simple things that you can do. Gate it. We do it for children. You can do it for your dog. Encourage your dog to wear a harness and minimize the amount of times you take them up and down the stairs. So Holly sleeps upstairs with me, but I tend to carry her up the stairs and down the stairs now. I used to just use a harness to help her up and help her down, but unfortunately legs are quite weak now. But you can minimize the impact without completely changing your lifestyle. Make sure that they've got grip, carpeted, ideal, definitely mats at the bottom. Think of the speed that your dog will gain coming down those stairs and hitting that slippery surface. A lot of people, when I see them, will say, he's so enthusiastic coming down the stairs. And as soon as I say, no, that's because he's out of control, because he's got no strength to control his speed. this light bulb goes off and the guilt hits. So just think about why your dog is coming down the stairs so quickly and why they go up the stairs so slowly, or they bunny hop, and ensure that they're well lit. People always think about stairs as being the ones that go to the first floor or the second floor, but there's actually stairs all around us. Front door, back door, between rooms, from the patio down into the garden. These are all stairs, so the same principle does apply. Hidden steps. These are a corker that people often don't even notice. So I often say to my owners, pretend that you're wearing high heels. Yes, men, pretend. Walk around your house, and anywhere where you would hesitate or check yourself might be an area that your unstable, weak dog will also struggle. So this is a lovely, beautiful blind step here. You can hardly see it. And then I hate these PVC door frames. When you have an older dog that has had gait change, quite often the gait change is a shortened gait length. Therefore, being able to step over this becomes a lot more difficult, and instead they will perch their foot on it. And if slippery, they will slip. So please do look at PVC door frames. Again, hidden steps. Don't underestimate the fact that you'll have comorbidity with deteriorating vision. These will be quite hard for a dog to negotiate, being able to clearly see where a step begins and ends. Slippery floors. So this, sadly, is a ratio. Unfortunately, he has been put to sleep and the condition was worsened, and he went off his back legs. Now, this floor was terrible, and this quite blind step, you can see that he really, really struggles. He hesitates, almost fears it. His tail's lifting, his head's down. He doesn't want to do it. And then, as you see, he's encouraged to negotiate the step. His feet slip away from him. Think what that would be doing. So, slippery floors, they come in all shapes and sizes, and it's amazing how people don't notice that they're slippery. And do you know why? It's because quite often we wear our shoes on them, because we're all about cleanliness, we're all about sweep clean and mop clean, which means that we don't need to take our shoes off, and our shoes come with rubber soles. Dogs don't come with rubber soles. They rely heavily on engaging their claws for grip. Pads themselves haven't got a huge amount of grip, and pads plus fur plus not being able to engage claws makes them very, very slippery. So simple changes can make a massive difference. Rugs, runners, rubber mats. You should see my house. It's ridiculous. There's mats everywhere. Prevent access. There are other products available. You've got lots of swimming pool paints that provide grip. There's anti-slip tape, which we're going to come to. But also think about where you're going to target. Where does your dog go? Where does it walk? A big pet hate for me is seeing dogs come off sofas onto slippery floors, or downstairs onto slippery floors, or being fed on slippery floors when they're really excitable because the food's about to come. So target where you're going to put your non-slip surface. There's lots of other solutions out there. In honesty, I prefer rugs. I really do. I prefer rugs and runners. I find that the eye gets used to it. You'll not notice you've even had it there in a couple of weeks, whereas these can be quite laborious. They fall off. They can be difficult to put on. But in those situations where you have no choice, then there are products out there. And at the moment on Facebook, we're trying to review products and see what works. I recently used the Paws Booties and made a laughing stock of myself because I just couldn't get them on easily. I've tried soft claws, but my gluing technique is not great because they fell off. So, but there are products out there, and we're hopefully going to get to the bottom of what's really, really useful. But rugs and runners, way forward. There's foam matting, there's yoga mats. This is what they use in garages. This is from Halfords, jigsaw pieces, rugs, and you can even see with this dog, I prefer to be on the rug, thanks, rather than the slippery floor. But do go and look at our Facebook site because we've got lots of tips and ideas there. Just a quick plug for our anti-slip tape. This isn't actually, it's quite a funny one. It's not really got any margins in it to make us any money. What it's trying to do is get people thinking. In the vet consult room, talking about environment change, house adaptations tends to be last on the list because you have so much else to talk about. But what we'd hoped is by being encouraged to sell this product, people would look at the packaging, go to the resources online, the Facebook, the website, and they would be empowered to start other changes around the house. So yeah, it's an interesting one. It's doing okay. Raised sleeping arrangements. All of us are a little bit weak with our dogs. We often allow them to be on the sofa or on our bed or in the armchair. Just think about how easy it is to get up there, and more importantly, how easy is it to get down, and what surface they're getting down onto. Having a stumble and a trip and a heavy fall repeatedly is not going to be helping your dog's condition at all. Beds. Oh my God, if only there was one answer. There are numerous beds out there that are beneficial, but the principle is making sure that your dog is waking up from a warm, cushioned environment is ideal. I know when Holly sleeps on the cold tiled floor, she is really a lot stiffer in the morning than she is if she has slept in the bed. Guidelines with purchasing a bed is that we like them to be very easy to get in and out of. So the front end must be widely open. We prefer them to have a backrest. We like them to have defined edges so the dog knows where the bed begins and where it ends. We don't like these puffy, foamy ones where they put a foot on it and they don't know whether it's deflating bouncy castle and they become unstable. My little tip is children's cot mattresses are really, really good. They're very cheap, secondhand, because people don't have secondhand cot mattresses, and you can just put a bumper around the back. So if you're looking for a cheap option, that's very beneficial. Potential bed hazards. Too many blankets. Us owners, we just love to throw luxury at our dogs. We want to keep them warm and wrap them up. Think about how they've got to get up and get out. And if that rug or that blanket, that fleecy thing is caught around their legs, it's going to turn into a trip hazard. So be careful with these things. A bit of vet bed, a fleecy blanket that's tucked in around the edges is much better. And it's going to be less risky. If the bed is raised off the floor, just watch your dog. There's a lot of people that are using these raised beds, and that's absolutely perfect as long as the dog doesn't clip their back feet or trip and fall as they step in or stumble on the way out. Feeding time. So what we tend to do, I'm a real advocate of using your feeding time as a chance to do some exercises, some movement. So Holly tends to have Kongs. I find it's really good for extending feeding time. It's also using her neck, her shoulders, her phalanges, her digits, her elbows. She's leaning, she's moving. It's a nice, gentle, low concussional way to exercise the forequarters of a dog. I also do scatter feeding with her, so I throw a lot of her kibble out into the garden and she has to go and look for it. And I find this is really useful for exercise, for her looking at where she's placing her feet, etc. With regards to feeding indoors, we do try and encourage people to come up with some kind of raised feeding surface. Theory behind it is, for example, say if you've got a dog that's very weak in their hind limbs and they've been throwing their weight forward into their shoulders and neck for a long period of time, they're going to get secondary compensation problems there. So muscles are going to be tight and quite uncomfortable. So leaning forward onto an already uncomfortable region is like asking you to eat your dinner whilst doing a handstand. So just by raising it slightly can be a lot more comfortable for them. I can remember a case of mine called Hector, and he had elbow arthritis. So he found it quite hard to bend and lean down to his food bowl. So what he would do is he'd spread his front legs wider so that he could get down there, but then that created other problems because he was stretching through his pectorals, etc. So gently raising the food bowl is really beneficial. There is some evidence that it can encourage bloat if you're allowing them to eat large quantities of food at speed. So a recent feed in the Facebook, we strongly suggested water. We suggested feeding food at a not too elevated level, so below shoulder level. Encourage them to eat slowly as well. Car access. Vets always mention this in the consult room. We tend to believe that every acute flare is because a dog must have jumped in or out of the car. I now know and believe strongly that it's the slippery floors, it's the stairs, it's the patio, it's the decking. But getting in and out of the car is a very, very important area that injury can happen. Jumping in and out of the back. So ramps and steps. This is one of my clients. This is Truffle. And getting into the car, I think it's so cute. So do think about that. If you can't help your dog in so that they're and out, so that they're not hurting themselves, then do think of getting something to adapt that routine. Another area, dog flaps. Yes, two stories that really illustrate this point. So Lola, she was a 12-year-old boxer. Her mum used to work in the city, so she had long hours, and Lola was at home and got walked by a dog walker, but she had access to the garden for peas and poos for a dog flap. Now, we'd done a house inspection verbally in the consult room, but at a later date I went to visit the owner. And we were looking around the house, and she'd put some rugs down and she blocked off the stairs. And when we came to the kitchen, I saw her dog flap, and around the edges of the dog flap were brown, because the dog flap was actually still the same dog flap that she'd had when she was a lot younger. And the owner hadn't realised that she had really struggled to get in and out. She had to throw herself through the dog flap, clipping her knees, which is where her arthritis was, and she had to clamber back in. Once we changed that, we saw a dramatic improvement. Another case was Rossi. He had a forelimb lameness, and it wasn't until I did a house visit, I think that was the fourth treatment, I realised that he had a dog flap with a 2-foot blind drop onto decking, and then another 2-foot drop onto the garden where he could have a wee. So things like that really will exacerbate and prevent an injury healing or being managed appropriately. So just a few little plugs for CAM, because we're running towards the end. I've managed to keep to time, which is quite incredible for me. We have got an OA booklet out that we're really trying to get vets around the globe to start using. It's designed like a vaccination card, and it includes reassessments, like a crib sheet, and also it includes the CSOM approach, enabling owners to make more objective measurements about how well their dog is doing. So yeah, please do look that up. We also have on our website some client resources that we hope will be useful to you. So there is a checklist that you can print off and you can look through to help you manage your dog's condition more. We've also got a good day, bad day diary that can be used when you're changing your treatment regime, or unfortunately it can be used towards the end of care when you're having to make those horrible, horrible decisions. Again, a little plug for the CAM anti-slip tape. The truth is out. It's not a very good fun generator, but we really hope it is going to start making people realise that these house management changes are imperative to having long-term pain control. Wee little plug about our CAM calendar. These are all of our clients. There was a big competition. I think we had about 200 and something entries. So choosing 12 was extremely difficult, but that is out there. So if you're lacking a Christmas gift, then please get in touch. My take-home message for the first of hopefully a few of these owner webinars: if it seems too good to be true, it probably is. And that really, really harks back to that story about that lovely little old pensioner that was spending a vast amount of money on supplements that were claiming improved joint health, improved mobility, all of these lovely phrases. I just want to point out something. When you're watching your dog struggle, you yourself become very vulnerable. And it leaves you looking for any avenue, any avenue. There is a condition called caregiver placebo effect, or placebo by proxy. And it's extremely powerful. And I just want to point out how powerful it is. They did a study where they put a number of owners, they gave a number of owners a placebo to give their dog in the belief that it was an anti-inflammatory. Now, they didn't obviously tell the owner, and they didn't tell the vet. After a few weeks of being on the placebo, 56.9% of owners saw improvement. And what's even more interesting, between 40 and 45% of vets saw an improvement. That was placebo. So we've got to be really aware that when you really want something to work, you can almost visualize that it does work, but the condition itself hasn't changed. So what I would really strongly advise is that when you're looking at products that are out there, please do look into the evidence of the claims and be objective when measuring your own dog. So all of us do different things. So for example, Holly at the moment, she's having free swimming hydrotherapy. She does therapeutic exercise. She is on a supplement. She is on a anti-inflammatory, no names. She is on a long-term drug called amantadine. And yeah, the list. And I have my house management. I look at my objective measurements. That would be really different to another person's dog. So I do what I do because I'm objectively measuring whether what I've implemented is making a difference. And I would really encourage you to do the same. Now, so anything too good to be true, the exception obviously is Cam. I just want to introduce you to our team. I'm really proud of the people that I'm working with, and I'm really grateful. Anything that has V after it isn't vegetarian, it's voluntary. So Kirsty, Catherine, Gwen, Lindsay, Shona, and Daisy. No, Daisy's my PA, but still love Daisy. But all of those people with the V, they are working voluntarily to try and get an online resource for you owners. So please take advantage of it. I'd really encourage you to log into www.caninearthritis.co.uk, to log into the forum, www.cam-foundation.co.uk, and find us on Facebook, Twitter, and Instagram. So that's it. Any inquiries, please contact Daisy.
Wow, that's a lot to take in, but it was fantastic. Thanks so much, Hannah. I really enjoyed that. I'm sure everyone else did as well. I do have some questions here. Let me see. Okay. The first one here is, I have two dogs. One is 12 and the other is 2 years old. My 12-year-old is already starting to show signs of arthritis. What can I do to prevent arthritis in my younger dog? So this person is concerned about their younger dog.
That's a big topic. See, we need a lot. Well,
yeah.
First of all, we need to be looking at what breed you've got and whether they're predisposed to any forms of arthritis. So there is definitely a genetic predisposition in certain breeds. So that's an area that you could be working with your vet. Go and see your vet and say, right, I've got this breed. You know, what are they likely to get? Can we do a clinical and orthopedic examination to see if there's any signs of joint discomfort? And what a lot of people don't realize is that 20% of dogs over the age of 1 have arthritis. That's quite mental, isn't it? We've got lots of breeds that have joint irregularities that predispose them to early onset arthritis. So look at the breed, get a vet check, get an orthopedic exam, look at your lifestyle. So you want to be encouraged that aren't going to be putting a huge amount of strain through those joints. You certainly could introduce a supplement earlier. We know that they're more effective the earlier that they're introduced. We need to have cartilage in these joints for these supplements to be beneficial. And start working with a therapist. You know, I'm a total convert now, total convert. And if only I knew what I know now, I certainly would have been taking Holly for a treatment, you know, a few times a year, check how she's doing, any sign of muscle imbalance? Is there any postural change to give me the first indicators that I've got a problem?
Okay, thanks. So let me just go to the next one here. They're all popping up now all of a sudden. Would you recommend any specific exercises that owners
You've
can
gone
do?
quiet again. Can you shout?
Yeah, I'm shouting. Can you hear me?
Ooh.
Oh, it's horrible connection all of a sudden. Can you hear me?
It's very, very faint.
Okay, give me a sec. Can you hear me now?
Right, I'm going to unplug and plug back in. Right now.
How about now? How's that? Is that good? Hello? Hannah? Can you hear me? Can you hear me, Hannah? Yeah, I can't hear Hannah for some reason. Maybe just unplug Hannah and try and do it without your headset. And talk to me. Oh, sorry, folks. We're just going to sort this out quickly. Try plugging in again, Hannah, and then clicking OK on the headset. You plugged in, Hannah? I think Hannah's disappeared. I'm so sorry, everyone. We're going to have to cut it short for tonight. I know there's lots of questions out there. If you're desperate to get your questions answered, you can drop us an email. It's info@onlinepethealth.com. Thank you so much for watching, and thank you so much, Hannah, for a lovely webinar this evening. Good evening, folks. We'll see you again. Bye.